Post-op or surgical bed. First, we should all assemble the equipments needed. Next, we should wash our hands to prevent cross-contamination. Now, we adjust the bed to the highest horizontal comfortable working position and lock the bed in place. This is to keep good body mechanisms. And after that, we strip all used linens to the bed and place it in the laundry bag if the bed is previously occupied. All soiled linens must be placed in the laundry basket to avoid contamination. And now, we will make the bottom part of the bed. This is to provide partial bedding to the mattress. Now, we spread one bath blanket across the bed on top of the draw sheet and bottom sheet. The bottom end of the bath blanket should be even with the foot of the mattress. Now, we spread the second bath blanket across the bed. The upper edge should be about 6 inches from the head of the bed. The second bath blanket also provides additional warmth and protection for the patient after surgery. Now, we put the top sheet, the regular blanket, and spread it on the bed, and do this the same way as we make the closed bed, but do not tuck them in at the foot. By not tucking the foot of the top sheet, it facilitates the smooth transfer of the patient, because tucking the top linen at the foot may hinder the patient to enter the bed from a stretcher. And now we can make the cuff. Same as the open bed, except you fold the blanket under the cuff. A cuff on the sheets makes it easier to the patient or nurse to pull the blanket up. Now we go to the other side of the bed where the stretcher will be in place, because we will make an open side of the bed in which the stretcher will be in place to facilitate easy and efficient transfer to the patient when it arrives from the operating room. Now, we grasp the top bedding at the side with both hands, fold the bedding across the bed so the folded edge is even with the far side of the mattress. This is to create the open side of the bed. The open side is more convenient in receiving the patient than the closed side. By folding the linen at the edge, we can now readily cover the patient with a blanket when it is transferred to the bed. Now, we put the pillow into the pillowcase. Put the pillow upright against the head port, and the pillow must have a pillowcase to avoid cross-contamination. And it is placed upright against the head port because it is not still used by patient after surgery, since They are required to lay flat in bed to prevent spinal and headache. And now, we move the bedside table, chair, and any other furniture out of the way. The bedside table and other furniture must be moved away from the stretcher spot to facilitate easy transfer when the patients arrive. Now, we remove everything from the bedside table except a box of tissue and a emesis basin for patients' vomitus and other discharges. And now we bring an IV pole into the room and place near the head of the bed because the IV pole serves as a stand to IV fluids for the patient. It must be placed near to the head so that it will be accessible for the nurse to check. Now, we position the surgical bed to match stretcher's height. And lastly, wash your hands. Wash your hands to remove bacteria and to avoid cross-contamination.